Yeah.
Hi, Elizabeth.
Hi, Kristin.
I'm so excited to have a conversation with you today about affect phobia therapy and deliberate practice.
Me too. I am. Yeah.
So I'm wondering if we could start just by you sharing with me how it's come to be that you are both an affect phobia therapist and an expert in deliberate practice. How did that happen?
Oh, such a beautiful question, Kristin. Um, I think I know parts of the answer. I don't know all the parts, but the conscious parts I'll tell you about. Um, as you know, I'm a dancer from before, and in dance you have to practice a lot, especially those parts that you are not so comfortable with, the hard parts and so on. So you really have to focus on very specific parts and do them again and again and again and again. So you really train them. And then as a therapist, when I learned therapy work, I understood that sometimes it was like theoretical philosophy. People spoke a lot about what they thought was going on, and they didn't do the crafts work so much. And in APT, I think with you, Kristin, it's been very much, I mean, we really watch films and we pick out specific moments where we have to train things. And I really like that, and I recognize it from my dance word.
Hmm.
And and then as I was in a workshop with deliberate practice, I said, oh, here's something that connects these dots, the dance word with the therapy work that I'm doing. So I really love this connection of being very specific and train yourself at the things that are really hard for you to do. As
Right,
in APT, when we talk about the therapist affect phobias.
right. Yeah, and so for you, at this time, like what type of deliberate practice do you do in your own work?
Wow. For the moment, actually, I'm training on saying no to things. And
Huh?
I can do, I mean, if I have too much work, I have to say no to things and to choose. And that's also a
Mhm,
thing of being specific. Now
mhm,
I can do this, but I can't do that. And
mhm.
the more specific I'll be, the more focused I be, and the more trained I'll be in the thing I do.
Mhm.
So I sort of cut off the things I don't do, and then I can really focus so I'm not scattered all over the place. So that
Oh,
really helps me.
yeah, so this is interesting. So for you right now, your deliberate practice is being able to focus in on what you want to do
Yes,
and to protect that by saying no to what you don't want to do.
exactly, exactly.
And do you have any like things that you keep in mind to help you remember to say no? Like, are there any tricks that you do to just help you to remember or to help you actually say no?
Oh, yes, of course.
Yeah.
And for me, it's the first thing. And this goes for me. And I mean, as therapists, we're no different than our clients. I mean, so what I train, very many of my clients have to train as well. I mean,
Mhm.
especially if you're exhausted and you have too much work. I mean, it's easy to say that you should say no. But if you don't
Right,
know what you'd like to do, it's much harder. So you really
right,
have to know something about who you are to be able to say no to things that you don't want to do.
right.
So the trick for me is to sort of, when I get some work or some suggestions about what I'm going to do, the first thing I do is to make space between the question and my answer. So earlier I used to say yes, of course, to everything, but now I make space. So I sort of, oh, that's interesting. Let me think about it. So I make some space, and then I'll be back to you and give you the answer. So that's the first thing. And the second thing I do to remind myself about this specific goal I have for the moment is actually to look inside and to really think about the suggestion when I'm alone, and to really feel, and what about me? Do I really want to do this? Or is this something for somebody else to do? So I really look inside to fetch up myself.
So it
I'm
sounds like,
able to go back.
so what I'm hearing is you practice a pause.
Yeah.
You say something to kind of, let the other person
Make a
know.
space. Yes.
You make space by just saying, I'll get back to you.
Yes.
And then you do like a internal inquiry, like,
yes.
what is it that I really want to do? How will
Yes.
this help me?
Yes.
Oh, fascinating.
Yeah.
And so you're just practicing that over and over and over again until it becomes more natural to you.
Yeah.
Yeah. Yeah. Well,
That's
it's
true.
interesting, like, even as you share what you're working on right now,
Mm.
what comes up for me as an APT therapist, and you are one too, is that you're also talking about sense of self,
Yes.
right?
Yes.
Like, who am I? What do I want?
Mm-hmm.
Sense of other, right?
Mm-hmm.
Do I want to engage with another person or not? How do I communicate that?
Mm-hmm.
And and also anger assertion, like the ability
Yes.
to assert yourself and say
Yes.
no.
Yes.
And then I think also like self-love, right?
That's true.
Like you're being very loving and caring of yourself
Yeah.
by asserting yourself,
Yeah. Mm.
and practicing the pause,
Yeah.
and
Yeah.
and giving yourself the space to kind of explore what is it that I really
Yes.
want.
Yes.
That's beautiful.
And when you say that, I'm thinking of what I love with deliberate practice is actually all the things you said is so true. But instead of saying, oh, you have to work with angry assertiveness, you have to work on self, you have to work on self-care and so on, all these things, or self-other, I have a very specific small learning goal, and I train it and I train it and I train it until anxiety goes down and I'm very clear about that goal. And then I can
Wow.
change to another goal.
Right.
So
So,
it's a small exercise, but it gives very much.
right. I mean, there's a book that's called The One Thing, and it's about choosing one thing to work on
Yes.
at a time.
Yeah. Yeah.
And if you choose one thing, then you can gain mastery over one thing. And a lot of people will have like a list of things that they want to change. They want to lose weight, they want to exercise, they
Yes.
want to
Yes.
start saying no, and they overwhelm themselves with so many different things that they want to do.
Mm-hmm.
And if you choose one thing, then you actually give yourself the chance to be successful with it.
It's true. It's true.
Yeah.
One of the guys I met, Darrell Chow, he said something about only chase one rabbit at a time. If you chase two, you miss both.
Right.
So you
Right.
really have to focus. And that's one of the things, small learning goals, to
Right.
really come together with your supervisor or coach or whatever you name it, and look at your work. What are you doing right now? Maybe you assess your work also, so you know really for sure what you're missing, and then see what can we do, a very small learning goal, a little step beyond what you know today, and then you focus on
So,
that one.
so something that I could do as a supervisor to incorporate this one goal approach
Mhm.
is that, with the APT consultation form, it's designed for like both self-assessment
Mhm.
and supervisory assessment.
Yeah.
And it gives people a sense of like the areas that they have to work on, right? Like,
Yes.
oh, I need to work on anxiety regulation, or I have to work on defenses, or I
Yes.
need to get more comfortable with the emotion of anger.
Mhm.
It might be really helpful
Yeah.
to rank
Yeah.
like what is it that a student actually does need to focus in on
Yes.
first,
Yes. Yes.
right? And say, okay, do anxiety regulation first,
Mhm.
right? Work with the emotion of anger second,
Yeah.
and then focus on self-compassion third.
Yeah.
And then people can just focus on one thing,
Yes.
cross it off the list, and then go to the next thing.
Yes.
Huh.
And what you say now, I think it's really important, and it's really essence of deliberate practice is really to focus on one thing and to be deliberate about that and do it all over again and again and again and again. It's if you've been a musician and play the piano, and there's a special section that is really hard. Most musicians, they don't play the whole piece over and over again. They really focus on that specific part that is hard, and that specific part they really want to get their fingers around that one, and then they can play the whole piece. It's an economic way of
Oh,
working.
that's fascinating. In the therapist hour, when I interviewed Jason Sinay,
Yeah.
that really came across that he will focus on one thing
Yeah.
and work on it over and over and over and over again
Yeah.
until he finishes it. And
Yes.
uh
Yes.
and so it's fascinating that you say that.
Yeah.
You're also reminding me on the 10 session form that we use to track our patients' progress.
Mm-hmm.
We do have like problem number one,
Yes.
problem number two, problem number three, and
Yeah.
then we connect that to the emotional conflicts. Emotional conflict one, two, or three.
Yeah.
Maybe something that we could do as therapists is, while our patients will identify three problems, maybe just focus on that first problem first,
Absolutely. Absolutely.
and and then go to the second thing.
Yeah.
But the only thing that I could see getting in the way is
Mhm.
like when I'm doing psychotherapy, and this has happened to me so many times. I've been hyper focused on doing exposure and desensitization
Yeah.
with the patient with a specific affect like anger.
Mm-hmm.
And we're working with anger, and we're working with anger, and we're working with anger, and then all of a sudden, whoop, it
Yeah.
shifts.
Yeah.
And I discover, oh, we need to be working with grief right now, right?
Mm-hmm. Yeah.
And
Yeah.
then we adjust, work with grief.
Yeah.
Grief is resolved, and then we're able to get back to the anger. And so
Yeah. Yeah.
I would imagine if we apply this approach, like with the patient in session, we also have to be flexible
So,
when,
and that is skill in itself.
yes, how do you
That's a
develop
skill in itself.
flexibility?
Yeah. You might have to work on flexibility then. I mean, because that's another
Oh,
thing. I mean, we have to really focus on these things that are like common factors.
yeah.
It doesn't have to be. It's not about APT. It's not about CBT. It's not about any method. It's about a way of training yourself as a therapist.
Hmm. Hmm.
And I
Well,
mean, there's a reason why we do this, and that's because I mean, research has shown that we're slightly getting worse with, by time if we don't really focus and really train ourselves. And
right.
as we do therapy, it's a sort of a performance. We
Hmm.
need to train ourselves outside session and
Hmm.
outside supervision.
Mm-hmm.
And the solitary training is the thing that really is the most important part, where we
Mm-hmm.
really sit and practice. And we can
Mm-hmm.
do that in role play with friends, or we can do it by just watching our therapy film,
Mm-hmm.
picking a specific thing that you want to work on right now.
Right, right. Well, it's interesting because I know, like with my own development with Lee McCullough, it became really clear that anger assertion was a block for me.
Yeah.
And and Lee actually had to sit me down
Mm.
and tell me that I needed to work through that block, or I would be asked to leave the research group. And
Mm.
I remember her saying that I needed to come up with like behavioral techniques where I would put myself in critical settings where people were prone to judge me. And I had to speak up and then bear the shame of speaking up and whatever would come next.
Yeah. Yeah.
And essentially, she was teaching me to toughen up
Mm.
whenever I asserted like my sense of self.
Yes.
Right.
Yes. Yes.
And then in the same breath, she put me in the patient's chair and then led me through an anger exposure,
Yeah.
so that I could experience like what was it like for me to get in
Mm.
touch with my own
Mm.
anger
Yeah.
and to sit across from a therapist who's doing exposure and desensitization over and over and over again.
Mhm.
And so I was working in my personal life with anger assertion, learning how
Yeah.
to speak up
Yeah.
in
Yeah.
critical settings, and then
Mm-hmm.
having this opportunity for therapeutic experience.
Mm-hmm.
But I had to practice over and
Yeah,
over and
yeah.
over again.
and
Yeah.
and that's what it's all about. And also
Huh.
what you say so beautifully, and what I think is so good, really helpful with APT, is to really look outside this setting. It's not, when you train yourself as a therapist, it's not just for therapy, it's for your personal life. It's, and you can also, I mean, you can look back at your, in your own history, and see, hey, where does this come from? So
Right.
it's sort of, also when you do deliberate practice, it's sort of like your own therapy in a way. You really work
Right.
things through.
That's true because I remember I had anger assertion to work through, and then I had closeness. And in
Yeah.
fact, when I was working through closeness, I was working very closely with you at the time.
Yeah,
And
and I had to work through closeness as well.
right, and we were both kind of working through closeness together.
Yeah.
And then I don't know if you remember, I was showing video segments of me working through closeness with my patients
Yes.
too.
Yes.
And it became this obsession in my personal life, in
Yeah.
my professional life,
Yeah.
and I was just always practicing how to experience closeness, how to give and receive.
Yeah.
And yeah, thank God for Adam Grant's book Give and Take, because I remember that was like a breakthrough moment reading his book and just finally getting it.
Yeah.
Closeness is about giving and receiving.
Yeah. Yeah.
Uh,
You trained your
Oh,
receiving capacity, Kristin.
right, right, right.
Do you remember also, I mean, we did a role play once, and we did
Yeah.
this the same, it's a very short um, sequence from your therapy film. We role played it again and again and again and again. And that's what you do in deliberate practice. And the
Oh,
good thing about that is that you don't take your supervisor's word, or you don't take the words that is in the book. You find your own words
right.
as you say the same thing over and over again, and then suddenly it shifts and you find your own way of saying it. And then
Absolutely.
you connect with your authentic way of being a therapist in your own
Right,
right.
right,
And that's
right.
what's so important.
Yeah, yeah. I mean, it's always been clear to me that what I do is help train therapists to be their very best own therapist.
Yes.
And it's over the years, it can be confusing. Am I teaching a therapeutic model, or am I training a therapist? And
Mhm.
they
Yeah.
all get blended together. But
Yes.
ultimately,
Yes.
what you said about, being really in touch with like who you are as a therapist and what makes sense for you really matters, because
Yeah.
that's the pathway to authenticity.
Yes.
and
Yes.
and it increases moments of meeting
Yeah.
when you're working with your patient. Like the
Yes.
truer you are to yourself,
Mm.
the truer you are with your patients, and it's really an invitation for them to be true as well.
Yeah. And that's so
uh,
important for, I mean, having a good outcome of therapy, that you're
right.
really authentic.
Yeah. Yeah. And how can you be truly authentic as a therapist unless you are willing and able to face your strengths, your weaknesses?
Yes.
I don't know
Yes.
if those are the right words, but to face like what you need to develop or to work through
Yeah.
in
Yeah.
order to have complete access to all of your emotions,
Hmm. Hmm.
and to really be able to be connected with yourself and someone else,
Yeah.
without a lot of fear and a lot of
Yeah.
defensiveness.
As you say that, I'm thinking of another thing I worked with. As I worked with you, I had this theme of closely to every comment or every intervention I did ended up with, and how is that for you as we sit here, you and me,
Yeah.
to
Yeah.
really train myself to be there and mention you are here and I'm here,
Right.
to really sort of end every intervention with that.
Right. And to end it with the capacity to really feel yourself connected inside and connected with the person you're working with.
Yeah, yeah,
Because therapists can be trained, that's the right thing to say,
yeah,
right? But patients can feel if it's authentic or not, right? They can feel if you're connected with them or not.
yes,
And so when
yes.
you ask someone, how does it feel to be here with me now? If
Mhm.
you're not feeling it, you know, don't ask someone that. It's too much pressure.
It
So
could be,
so in
yeah,
order for that technique to really work, as a therapist, you have to be feeling it. What is it like to be here with your patient,
exactly.
right? And if you practice what you preach, then asking them, what is it like
Yeah,
for you to be
yeah,
here with me
yeah,
now?
yeah.
Yeah.
Actually,
Yeah.
I said to one student once, he said everything right. He did everything in the right order as in the book, beautifully. Everybody said it looks beautiful. And I said, actually, the wheel is spinning, but the hamster is dead.
Yeah. Wow.
There's nobody there, and you really have to be there.
Right.
You're doing everything right, but you really have to be there because she's really alone, your client, at the moment.
Mm-hmm. Mm-hmm. Yeah, that story, you just brought tears to my eyes and a little chill.
Yeah.
Because that must have been very hard for you to point that out to your student,
Mm.
who obviously was putting so much time and energy in learning how to
Yes.
do it right,
Yes. Yes.
but was disconnected.
Mm.
What happened with that student? Was the student able to like
Yeah,
respond
he,
to
he
you?
could. He could. We had a really good relationship. It's a pretty
Mhm.
hard thing to say, but we had a really good relationship. And he was
Mhm.
really eager to get it right. So he's
Mhm.
really studied very hard. But he
Mhm.
got what I said and he understood it. And he's actually one of the students that have been coming back to me. I want some
Right.
more. So
Right.
it was, and that is also something that is really important when you do deliberate practice. You really have to look, you have to get out of your comfort zone and
Mhm.
into the learning zone
Mhm.
without getting into the panic zone. So you really have
Right.
to be into the window of tolerance. I could never have said that to another student, but this was the right thing for him to hear. That brought him
Right.
from the comfort zone to the learning zone. Okay, I've missed something. For another student, it could be too much.
Right. Well, it's like you're reminding me of my experiences as an athlete. I mean,
Yeah,
if I'm playing basketball and my coach is saying you need to work on, this certain shot, then
yes,
I spend the next, 4 to 6 hours every day that I can just doing that shot over and over and over again. And there's not a lot of emotion involved with that. It's just
no,
kind of like, oh, I got to do that. That's easy. Give me a moment in the game so I can show off.
yeah,
Uh,
yeah,
and so, sometimes being matter of fact with therapists about,
yes,
okay, this is just, this is what you need to work on, right?
yes,
And
yes,
here are some tools, deliberate practice. Okay.
yes,
uh,
yes,
I see it. Here are some tools to help you
yes,
learn what you need to learn,
yeah.
right?
It's
And
really well said. It's matter of fact. Yes,
yeah, yeah. And,
it
but,
shows that it's
right.
actually for these expert therapists, what they do is that they work really hard in
Yeah.
solitary practice. It makes a huge difference. It has not to
Right.
do with how you trained or what sort of method you have, how old you are, or you're a woman or you're a man. Nothing to do with that. It's
Well, and
about
that's
how
why, yeah, and you also bring up something else that's so important, and I think it's so key to the APT community, and that's community.
yeah,
Like being able to like learn together,
yes,
being able to like strengthen our skills together, being able to explore our emotions together.
mhm,
I mean, something that is so key to APT, and
mhm,
it's evolved over time, is
yes,
that we learn as a group,
mhm,
and we have our own team like when we come into core training,
mhm,
but then we're also creating our team back at our homes, like with therapists in the community or students or our own therapist or our
mhm,
own coach.
yeah,
uh, Everything that we do is a team approach,
yeah, yeah.
and it really helps.
It really helps. And especially if
Yeah.
you do this sort of work like a deliberate practice, it's hard work and you really
Yeah.
have to be consistent and you have because you have to be to keep up the motivation. You have
Hmm.
to be curious, you have to be creative, you have to be consistent. So a support group that would really help,
Right.
really
Right.
help. And in the
Right.
APT community, I think, I mean, you already have this beautiful tradition of really watching the movie, the therapy films, and you look at what happens with the client, but you also look at what happens with the therapist, and you have
Mm.
special focus to what can I work on here, what is important. So
Yeah,
it's
and
only a thing
sometimes,
to keep a focus, a strict focus on one thing at a time, and to really repeat that very
right.
much. Yeah.
And there's certainly stages, and the more therapists that I talk to, the more I see how there's so many different stages a therapist can go through in terms of like learning a skill. Like they
Yes.
can they can start watching movies where there's anger exposures in the movies. They can start reading books like Hilary
Yes.
Jacobs Hendel's book,
Yeah. Yeah.
and get
Mhm.
more comfortable about the emotion of anger or sadness.
Mhm.
They can watch video segments of psychotherapy and actually see therapists working with patient, and what those exposures look like. They can get their own psychotherapy and be a patient. They
Yes.
can
Yes.
do role plays in peer
Yes.
groups,
Yeah. Yeah.
and then they can begin to practice in their own office,
Mhm.
and video record and then code that segment,
Yeah.
And I think there's probably even more ways to learn.
Of course there are. And I mean, but the key thing is to get, as you've been training, I'm like an athlete, I think you know this.
Yeah.
You would never suggest a basket player to watch a basket film and then expect that person to be a
Never.
superb basket player. You
Never.
know, you have to engage the person. The person has to train themselves. And that's the key thing.
Well, and this is where I think you and I are so connected, because we're both dance movement therapists as well, right? You
Mm.
have to engage the body.
Yeah.
You
Yeah.
you know, psychotherapy is actually a very physical
Yes.
experience,
Yes.
right? It's,
Yeah.
we're not just sitting in a chair,
No.
right, and
No.
listening,
No.
right?
No.
We're highly attuned to the person that we're working with.
Yes. Yeah.
We're moving our bodies. Some of us do sit in chairs, but some of us get up and you know, work in different ways. But
Yes.
either way, like if you're really working with emotion, there's a lot that's happening
It's
in
a
your
lot that's
body.
going on. Yeah.
Yeah, yeah,
Yeah.
in your patient's body for
Yeah.
sure.
Yeah.
Yeah.
Yeah. And that's also one of the, I mean, the generic, I mean, skill in deliberate practice, to just turn the sound off when you look at the
Oh,
screen, so you don't
oh,
just listen to the words, you really listen with your eyes. I know you've had a workshop on that one, and
yeah,
it's really a key thing to do,
yeah.
to just turn the sound off and
Mm-hmm.
just have a look at yourself as a therapist
Mm-hmm.
on the screen, and have a look at your patient. How is this visual dance going on in the
Mm-hmm.
therapy hour? And you probably see completely different things than when you just listen with your ears. And that's so
Absolutely.
interesting to do. Yeah.
I think that's so important, because I know I was fortunate to have a father who would ask me to read a room. Like, what, don't
Yeah.
listen to what people are saying, watch what they're doing, right?
Yes. Yeah.
And as a little girl, he would say, okay, tell me what's happening, right? And I would have to come up with an answer. And then when I met Lee McCullough in 2003 and joined her research group,
Yeah.
all of a sudden I was looking at video segments where at the time we were just focused on the patient and the patient's affect exposure. But due to my, you know, training as a child, I couldn't help but watch, well, what was Lee McCullough doing? And what was the impact of that? And what's happening between these two people? And what's the interplay?
Yeah. 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 You
And
wanted to
I,
ask her, what's going on?
what's going on? And I'm
Yeah.
sure that was also my dance movement
Yes.
background too.
Yeah.
You know, being able to work with dance movement
Mm.
therapists who are always watching about what's
Yeah.
happening with the
Yeah.
patient's body and what's happening with the therapist's body, and
Mhm.
how are they working together.
Mm.
And
Yeah.
so yeah, I mean, one of the most exciting things for me in psychotherapy has been watching and being a part of that movement,
Mm.
from the patient focus
Yeah.
to the patient therapist focus, and the interplay between the two to the
Yeah.
therapist focus.
Yeah.
And once upon a time we'd be so focused on the patient,
Mm.
right? But now we can be focused on the therapist, and we can be focused on what's happening between the two of them.
Yes.
And
Yes.
you know, coding video segments has certainly like helped us get to that place.
Yeah, yeah. It's a really good thing. And if you do it, I mean, I know there's a huge tradition to do that in APT with this ATOS scale. But I mean,
Yeah.
if you do it in a deliberate practice way, you probably choose one of the areas, like I need to work more on defense work, or I need to
Hmm.
work more on anxiety regulation, or I need to work more on exposure for feelings. Then you choose one of them and you really focus on that one when you go to the ATOS
Right.
scale and the movie you're looking at. And that makes sense.
Yeah, it's so interesting, because I think deliberate is the important word here, because I
Yes.
know for me, I've watched so many video segments of psychotherapy, and I've worked with so many therapists where I'm able to say pretty quickly, you need to work on anxiety regulation, or
Mm.
you need to work on defense restructuring, or you need to get comfortable with working with the emotion of anger assertion. And we have the self-assessment form to like really help our therapist identify like where they need to work. But
Yes.
the piece that I think is missing is that deliberate piece. Like
Yes. Yes.
if I could have like an index card, right? After I watch, a video segment
Yeah.
and offer supervision and just offer one thing, like I could
Yeah.
write anxiety regulation,
Yes.
right? And
Yes.
if on the other side of the index card I had like steps of what a student could do in order to work on anxiety regulation,
Yeah.
like
Yeah.
watch more videos of anxiety regulation,
Mhm.
create a deliberate practice of
Yes.
anxiety regulation. I mean,
Yes. Yes.
you
Yes.
probably have all sorts of ideas as to like what a student could do to really practice and to get
Yeah.
good.
Yeah. Yeah.
Yeah.
And the thing is, when you try out different things, you'll
Yeah.
find what suits you. What
Mhm.
suits your personal way of being, so you can use that. So if you go home and you really practice on anxiety regulation,
Mhm.
regulating things to do, I mean, there's so many different things you can do, but you have to find out, what can I do, what
Right.
suits me, and then you train the things that really fits for you, so you really feel comfortable with that. I know you
Yeah.
had Michael Albert like in a therapist hour, and
Yeah.
I see him all the time in
Yeah.
different areas, and he's doing the same thing all the time, but
Yeah.
it turns out differently each time. He really
Yeah.
knows what he's really good at, and he does it, and it develops, and it turns out differently every time, and that's
Right.
really the thing we're talking about.
Right. 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 And Michael Alpert went through years of practicing psychotherapy before he discovered his one thing, right?
Yeah, yeah,
And has really become expert at it
yeah, yeah.
with his self connection approach, and having a video camera on the patient and the therapist,
Yes.
and paying attention to both experiences in
Yeah.
session.
Yeah.
Yeah. Yeah.
And that's what it's all about. I mean, to
Yeah.
really know what you can do.
Right.
And
Well,
that brings us back
I've
to the beginning. I mean, with
yes.
saying no to things, gives room
Yeah.
to what you really can do and what you are.
Right.
Yeah.
Well, and I mean, in terms of training, like two things come to my mind. Like number one, like I was always very comfortable in the feeling pull. Not an issue for me. I'm incredibly fortunate because that can be the hardest for therapists,
Mhm,
is to really learn
mhm.
how to work on the feeling
Yeah.
pull and to
Yeah.
work with feelings.
Mm.
Uh, Anxiety regulation terrified me. I would watch myself video after video, just skip over it. I would like be pleading with the patient, just feel your feelings, instead of actually like regulating their anxiety and helping them engage in regulating their anxiety too. And in order to learn anxiety regulation, it was a matter of like watching video segments of people who do excellent anxiety regulation. And the first
Mhm.
thing I realized is that you have to find the person who does it well to watch them. And it doesn't
Yeah.
matter what model they do, right?
Yeah. It's true.
Like,
True.
yeah.
Yeah.
So that's where
You
like the
got it.
APA videos come in. Like, I
Yeah.
mean, I've
Yeah.
learned things from Jeremy Safran, Paul Wachtel.
Yeah.
I there's just so many different like master therapists that
Yeah.
I've learned my technique from, just by
Yeah.
sometimes finding the therapist who works in a way that makes sense to me, right?
Yes.
And
Yes.
and
Yes.
and so so then I'll hyper focus on their videos and watch
Yeah.
how they do
Yeah.
it, and
Yeah.
maybe even go to a training,
Yeah.
and then start practicing in session with my patients, who are always so kind and generous. but they can't help but ask me, "Did you just go to a training? What are you doing?" And at this point, I just say, "I'm working on my anxiety regulation," you know?
Yeah, you have to do that. Yes.
Yeah, tell me how I'm doing. Yeah.
Yeah, yeah. Tell me how I'm doing. Yeah.
Yeah. Yeah.
That's a good thing. Yeah, but I
Yeah.
think that's the way you're talking about it now. It's really to you focus on a skill, and you really, I mean, it does no matter what sort of method it is. That
Right.
makes sense to you. I think you said it very well. Perfect.
Well, and the second thing connected to that is us being really hyper focused on ourselves
Hmm.
and how we learn
Yeah.
and what's important to us,
Yes.
because
Yes.
I know I always have a journal
Hmm.
that is up and running. I always know, okay, this is a piece of work that I'm working on personally, right? And for some reason, like my deep commitment to myself, my self-care,
Hmm.
um, my own emotional work, uh, it really helps me. It sort of trains me to focus on my psychotherapy skills too. So
Yes.
it's almost like I feel like sometimes I'm in training the minute I wake until the minute I sleep, because I'm either engaged personally in my process or I'm engaged professionally as a therapist.
Yeah. Yeah.
And always thinking, okay, how can I do this in the easiest, simplest way,
Yeah.
uh,
Yeah.
and get the most out of it.
Yeah. Yeah. When you say that, it sounds like really hard work and 24/7. But I
Yeah.
but I do recognize it, and I sometimes, as I've been working as a choreographer before, I know when I do my dances the best is
Yeah.
actually at the bus stop or
Hmm.
at the stove,
Right.
because I'm relaxed. I can just wait until the bus comes or the porridge is ready. And my mind is open, and
Hmm.
I'm just standing there, and then suddenly it comes to me. So we have to find our way of doing things and realizing things, and it can come up whenever. It doesn't have to be in
Right.
therapist hour. It doesn't have to be when you do your therapy yourself or when you supervise. It suddenly shows up when you're ready for it.
Right. Well, and I mean, the easiest way for me to describe a psychotherapist is, as an artist.
Yeah.
Like you have to learn the basics of your trade. You have to like build the basic skills. But then after that, it's like, how are you engaging in your work? Is it inspiring you? Like, is it causing you to grow and to become not only your best therapist, but your best self too,
The
right?
best self. Yeah, that's right.
Yeah.
That's right.
Yeah.
And
Yeah.
those two goes hand in hand, really. And
Mhm.
because if you will work with deliberate practice, for instance, you really have to be able to motivate yourself.
Mhm.
And I mean, and for that, you really have to look at the work as an art form, as
Right.
something you can be creative, you can be spontaneous, you can be interested in, and that really gives you something.
Right. Right.
So
Absolutely.
it's so important what you talk about. Yeah.
So Elizabeth, I'm wondering, like, for therapist in training in the APT, but it's probably in any psychotherapy model. Like, what type of advice do you have for somebody who wants to be an APT therapist?
I would love for them, I mean, to really have a look at what we've been talking about, like both, not just this is the patient, but also have to have a look on themselves as therapists, as persons, and to be really invent in being real and being human.
Mm-hmm.
How important that is to be a human being meeting another human
Mm-hmm.
being.
Right.
And I think APT is a really good way of doing it. And you can probably do it in other techniques and models as well. But I think it's so important. And it's also what we talk about in, I mean, the APA definition of evidence-based therapy is to really not just listen. We have to have a model that stands on a theory and is researched about, but we really have to listen to the patient that comes. What's the preference of the patient?
Right.
And as we are in therapy, it's also the preference of the therapist.
Hmm.
What do we prefer? How can we work as therapists? What
Mm-hmm.
are our personal preferences, to really engage and listen to that, so you can listen to your patient. I mean, it's a basic thing of empathy, actually, as a common factor of a good outcome. We have to
Right.
feel and have empathy for ourselves to be able to have empathy with our patients.
Right. And, so many therapists come into the field as givers,
Yes.
and they their defense actually is giving, giving,
Yeah.
giving,
Yes.
giving,
Yes.
giving, giving
Yes.
till you get sick, you know.
Yeah.
And a lot of what I do when I'm teaching and supervising is help draw attention to that giving defense, right? Like
Yeah.
there's nothing wrong with giving, but if you're giving till you're sick, right?
Yeah.
Or you're giving instead of listening,
Yes.
right? Or you're
Yeah.
giving instead of asking,
Mm, mm.
right? Then you have to learn how to close
Yes.
that behavior,
Mhm.
and to really draw inside, and begin to understand, like, what is your emotional landscape, what is happening inside of you when you are sitting across from another person,
Yeah.
right?
That's
And
true.
yeah, it's not an easy path, the
No.
the path to, like, true connection with yourself and
Yeah.
others.
Yeah. Yeah. So we come back and
And
then might train, I mean, to be the receiving capacity,
yeah.
to train to say, no, don't make any excuses if somebody say, oh, you look beautiful today, or what a nice dress, or whatever they say. Oh,
Hmm.
I really like this picture you have on the wall. To just say thank you, instead of
Hmm.
saying, oh, it's nothing. To
Right,
really
right.
receive.
And something that we've learned in APT along the way is how important atmosphere is.
Mhm.
Meaning, it's important to pay attention to, like, where you're spending your time, or
Mhm.
how you're spending your time, or what you're wearing, right? How you're taking care of yourself.
Yeah.
So that if somebody does pay a compliment to you or your environment, you actually have the capacity to feel proud. Right? Like,
Yes.
"Oh, you like this dress that I'm wearing? Thank you so much. I do too." Right?
Exactly. Exactly.
And one of the most beautiful aspects of watching students go through a 3-year core training program is I get to witness how they change during those 3 years,
Yeah.
and how maybe somebody who's wearing all black colors is now wearing brilliant purples and blues, and has a whole new hairstyle and a new way of being in the world.
Yeah. Yeah.
So it's a delight to watch therapists kind
Yeah.
of come to life
Yeah.
when
Yeah.
they're working with their emotions,
Mhm.
and I think also when they are feeling mastery over the skill of psychotherapy. Like, it
Yes.
feels
Yes.
good
Mm.
to
Mm.
learn how to do anxiety regulation, to know,
Yes.
okay, I have it. What's
Yes. Yeah,
next?
I have it. What's next? Exactly.
Yeah.
That's the thing.
Yeah.
So you get more self-confident, and you really need to feel self-confidence to be able to look confident to your client, to give them some
Right.
hope. We're going to make this.
That's right.
Yeah.
And let's talk about, we're going to make this. We can do this. It is
Yes. Yes.
possible.
Yes.
Like,
Yes.
you have to really believe it
Yes,
before you ever say it.
exactly.
And you need to know it within you need to know that you have moved through difficult periods in your life, that
Yes,
you
yes.
have been able to access an emotion that you've been avoiding most of your life, like
Yeah, yeah,
that you actually aren't experiencing depressive symptoms anymore, right? Now that you're able
exactly.
to say no to
Yeah,
others.
yeah. And actually, it's a really good thing. I mean, when you start training as a therapist, you can get very confused and a lot of
Mhm.
anxiety. I mean, there's so many things to learn, and you can
Mhm.
run around and do all these different things. And deliberate practice really helps us to focus on one thing. Was
Right.
where
One
can we
thing.
start?
Yeah.
Just make sure you meet the patient, be a good host, try to
Right.
find out what they want,
Right.
set up
Right.
a positive stated goal for what you're
Right.
going to do. That's the only thing, nothing
Yeah.
else.
Yeah, I think you're really helping me see that if I could help my students just identify one thing to work on,
Yes. Mm.
I'll never be able to stop just writing down everything that I'm noticing. I mean, that's
No, no, no.
that's I the way I look at it is I'm giving you ideas for the next thing, right?
Yeah.
But if I could just highlight, if I were in your shoes,
Mm.
this would be the one thing that I would do, and expecting them to reflect on it and to decide
Yes.
if is that the one thing that they wanna work on? Maybe not. Maybe they have a one thing that they would prefer to work on
Yes.
instead.
Yes.
And in the same way that I think I'm very open with my patients and trusting of their process,
Yes.
you know, maybe I could bring that trust to the students that I'm training, that they have an idea of what is their one thing, what do
Yes.
they need to
Yes.
be working on right now.
Mhm. Yeah, and
And
it's not always the thing that is the lowest points. I mean, if you sort of assess it, sometimes it can be something that I have motivation to do this, but I don't have motivation to do that. But if I do this first, which is a less problem, might be, but if I do this first, I might strengthen myself so I can do the work that I really need to do. So
right.
you have really a point there. We really have to sort of listen to our supervisees as well as the patients in the same way. What are they willing to do right now? Where can we start? Where's the starting point?
Well, and I was consulting with this coach. His name's Sean Hansen, and he's over here in the United States. And he was helping me understand that some people prefer to like work on the one thing that's easiest, right? So they can cross it off their list quickly.
Yes, yes,
But other people prefer to work on what's hardest
yes,
first.
yes.
And that there's not one way to do it. Like you
Mm,
have to actually figure out who you are
exactly.
and what works best for you. And
Yes.
and once you know that, then it's very easy to kind of figure out, okay, what's my approach? Am I going to take the hardest?
Yeah.
Am I going to take the easiest? And I'm sure that there's other combos there too.
Sure, sure. But it's the collaborative, how you can collaborate with the supervisee. It's really important to do that.
Yeah.
And it that
Yeah.
also makes you feel like you're a person to count on. My
Mhm.
supervisor wants to know what I would like to work on. She relies or he relies on me to make that decision for myself. So that
Right.
can also make you feel, I mean, confident in a really nice way.
Yeah, and I do think in APT with our consultation form, we do a really good job at letting the students choose what video segments they're going to show. It's
Yeah.
20-minute segment at the most.
Mhm.
And asking them to identify, what do they want help with, and and how do they want help with that? What type of feedback do they want?
That's a really good
Now,
thing, Kristin. I love that one. To
yeah,
validating feedback or critical feedback or constructive feedback. I mean, it's really good. And I use it a
right.
lot. And it's really helpful.
Yeah, the only time that I worry as a supervisor is that sometimes what a student identifies is not necessarily what I see. And
That's true.
I probably need to get a consultation with you about how to properly deal with those situations, because a student might say, I want to work on this. And then I watch the video and I'm like, we're going to be working on this. And I make like an executive decision.
Yeah.
And I feel, I know that that's hard.
Mm.
And maybe after this interview today, I'll practice my pause. I'll
Yeah, that's a good
insert
one.
Yeah, I'll insert, let me think about this. Would it be okay if we explore in a different direction? Uh, and maybe wait for a yes, right?
Even
And then
that?
say, this is what I was looking at. Because,
Yeah.
my motto is whatever is the problem is not the problem. So
Yeah. Yeah.
I can get in trouble sometimes because
Yeah.
of that.
Yeah.
So
But
yeah.
it's a
Yeah.
very respectful reflection, I think, Christine, to just
Yeah.
make a little space. Oh, good thing to do. I mean, we do it with
Mhm.
patients all the time. They come and they
All the
say
time.
something, and then you see all these problems, and that's not the question,
Right.
because you get this question, and then you have to. I can't remember who said that, but you always have to take the thing that is in the front first. Might be Alan
Mhm.
Abbas, I don't know. Uh, so if that's the entry point, I mean,
Mhm.
take it. And then you can
Mhm.
sort of and you can scoop into that one. And maybe you can come to the big one later, but accept what's in the front first.
Right. Well, I think that's why we identify with our patients what problem do they want to focus in
Yes.
on. And
Yes.
and we have the pack form that we use, the 10 session form,
Mm.
and then every session we start that way.
Yeah.
And then keeping in mind just asking for examples. Can you give me an example to like kind of bring it to life so that you could just see the anxiety that comes up and the defenses and the feelings. So, but it's absolutely true. Like, you know, really focusing with someone on what they want to
Yes.
work on.
Yes.
It, it's, it's, it's trusting their own, you know, intelligence,
Yes.
desire,
Yes.
motivation, and
Yes.
then staying focused, crossing off that one thing, and then
Yeah.
going to the next.
Yeah. Yeah.
So it also lets people feel like a lot of mastery, like
Exactly.
they got something
Exactly.
done. Because
Yeah.
I don't know how you feel. I hate it when I hear people say psychotherapy is such a long process. Psychotherapy is so expensive.
Doesn't have
You
to be.
know, it doesn't have to be. Like you can
No.
focus
No.
on one thing,
Yeah.
resolve it, and then choose
Yeah.
if you want to continue or not.
Exactly.
So,
Exactly.
but what I'm learning, Elizabeth, is that we can do this with training students too, and
Absolutely.
maybe taking some of the things that we do with patients and then bringing it over to training, that could really help.
Absolutely.
Yeah.
Absolutely. Yeah. Yeah.
Well,
Uh,
I want to thank you for taking all this time with me today. Is there anything that you wanted to share or yeah, before we begin to close for today?
actually, I was thinking when you spoke about this at the end that we have two deliberate practice exercises already there.
Okay.
One thing to train is, what do you want to focus on today? To
Mm-hmm,
really train
mm-hmm.
that one.
Right.
Um, and the second one, I forgot right now. I might be
Ah,
tired.
well, it is rather dark in Sweden right now
It's
and
really
late.
dark. It's really dark.
Yeah, and we have a 9-hour time difference. I've been watching the morning move from dark to light right now,
Yeah, and
in our
it's the
conversation.
opposite
I'm
here.
getting lighter, you're getting darker.
Yeah, that's true. But it's been
But
really great to do this together with you, and especially
yeah,
since I've been going to your core training. It feels really
yeah,
like coming home and to putting
yeah.
things together. I mean, the APT has a long tradition of watching film and assessing what's going on in the film, and together with with the deliberate practice, it's really good thing. They can really get things out of each other. It's a really good mix.
Well, and my hope, Elizabeth, is that, you'll help guide the APT community in terms of like, how can we use deliberate practice in order
Exactly.
to improve our personal lives and our professional life?
Yeah.
And just this moment that we're having together feels like a really good step forward for the APT community, as well as other therapists who will gain a lot from our talk today.
Yeah, I hope
So
so. I hope so.
thank you so much.
Thank
And
you,
and
Kristin.